Hello and welcome to our fire safety video, which we have put together to give you an overview of fire safety, how fires start, how they spread, how they can be contained, what you should do in the event of a fire, and specifically we will be linking a lot of the information in this presentation to the health and social care setting and how it will help you go about in your day-to-day duties to keep yourself, the client and your clients safe. When we're talking about fire safety, we are referring to the regulatory reform order which we must stick to. It refers to anyone who's employed, employers, self-employed, office spaces. If a space is used for a business or accepting paying guests, and that doesn't matter whether you're a charity or whether part of the building or only part of the building is used for business purposes. Those responsibilities extend to keeping your fire extinguishers up to date in terms of the service and the pressures and making sure they're maintained, fire alarms, smoke alarms, emergency lighting. All of those kind of things are included in the 2005 Regulatory Reform Order legislation. In terms of how fires start, we have the very basic fire triangle, which I'm sure most people remember from, I don't know, key stage whatever science. The three elements of the fire triangle are, of course, oxygen, heat, and fuel. And without any of these three things, the fire cannot survive, start, or continue. So let's go through different types of fuel. We have your traditional fossil fuels, so coal, petrol, and wood, and really anything which burns can be considered a fuel. So that's curtains, upholstery, even creams such as kind of dipper base, zero base, anything with kind of an oil, paraffin, or that kind of base to it can be considered a fuel and can fuel and start a fire. So clothing and textiles and even waste, and a buildup of waste is a big, or can be a big, fire hazard. Sources of oxygen is quite an obvious one for most of us. Oxygen is in plentiful supply in our atmosphere and all around us. But in a care setting specifically, or in a hospital setting, or in a social care, healthcare setting, you may find concentrated sources of oxygen, and this can pose a bit of a risk, particularly where people who need oxygen are often smokers, where they've got lung damage, and if they're smoking with oxygen, this can present quite a large risk to you as care professionals. If you do find that someone is smoking and using oxygen and you are there at a call, you can ask the person to stop or leave immediately, ring the office and tell them why you have left and the risk that that poses. It's a very real risk, and we have had a client blow themselves up, for want of a better phrase, for smoking while using an oxygen bottle. Thankfully the carer had left about 20 minutes before. And finally, onto the third part of the fire triangle, which is heat. And in the home and as carers, you'll come across many sources of heat, including cooking appliances such as microwaves, things which create a spark, so that's the cooker or the gas fire, matches, ovens, like I said, cooking appliances, microwaves, microwave ovens, overloaded sockets, brilliant source of heat because they get really hot as electricity runs through them, so we must watch out for overloaded sockets, and cigarettes. So any clients, particularly older clients, may still smoke quite heavily, and if they're not quite sure or they haven't stubbed a cigarette out properly, this can be a bit of a hazard. And we have plenty of clients who in the past and maybe even in the present who need fire blankets, kind of fire retardant clothing just to keep them safe because they may not be sure of what they're doing. We have a little chart here for the common causes of fire. 51% is cooking, and you see that's really, really high, the common cause of fire. Electrical appliance, electrical distribution, smoker's material, space heating and other, and that chart just shows you what the common causes of fire are, and obviously these things do change year on year, but this is the chart that we found online. In terms of the biggest killers in fire though, it's a little bit of a different picture than the table on the left. The biggest killers in a fire are smoke, burns and smoke, and obviously that trauma to the skin, and then other, whatever that may be. I suppose that may be something falling during the fire and hitting somebody, or panic during an escape. I'm obviously unsure on that one. But because smoke is such the biggest killer there, or burns and smoke, the key thing there is to raise the alarm and evacuate as quickly as possible to get them away from the smoke, away from the fire, away from that heat. But how do fires spread? So these fires can spread, or they do spread, in three different ways, and that's through radiation, convection and conduction. Radiation refers to the waves of heat which are emitted from the fire, and the best way to describe this is if you are further away from the fire, you're happy, you're not so hot, but if you get too close, you can feel those heat waves coming at you, and you'll soon start sweating, soon start getting too hot. And if you face the fire, it's really hot, but if you turn your back, you'll notice that because the waves only go in straight lines, your back is being heated, but your front won't be. In terms of convection, this is the air, and I'm sure most of you have heard of convection currents. So as the cold air gets blown in, it gets heated up, and that hot air then expands and rises on the fire, and that's why the smoke will go into the air straight upwards as the cold air is drawn in from underneath, and the hot air gets sent upwards as it expands. And conduction is the heat transfer from the solid. So you'll get kind of as the fire spreads along, say it's in a house fire and it starts on the arm of the chair. The solids will heat up, and it'll heat from the arm of the chair to the cushion, to the carpet, to the curtains, and that's how the fire spreads through conduction. And you'll notice that anything really is a conductor. It's either a good conductor or a bad conductor. Is why when you see old pans with wooden pan handles, the wood is actually a very poor conductor of heat, and that's why you can find that you can grip the wooden handle where you wouldn't be able to grip the metal of the pan itself. In terms of controlling a fire, we've got 3 different methods again, and each of these methods refers to a section of the fire triangle, and those are starvation, cooling, and smothering. So each one of those actions removes a part of the fire triangle to stop the fire, to kill the fire. So starvation takes away the fuel, cooling takes away the heat, which is quite obvious, and smothering takes away the oxygen, which I always remember quite morbidly as kind of smothering with a pillow. That takes away someone's oxygen, stops them breathing. There may be, and probably are, many other ways which you can remember that. So in terms of starvation, take away the fuel, I always think of the kind of the moors fires, the bush fires. They try and get ahead of the fire and cut away all the dead and dry material so that the fire doesn't have anything to burn once it reaches that point. In terms of cooling, water I always think is the easiest one, but obviously foam fire extinguisher will also cool the fire. And smothering, you've got CO2, so as it's blasted at the fire, it replaces the oxygen in that particular area. You've got foam fire extinguishers and dry powder, which also smother the fire, and the fire blanket. And I suppose a wet tea towel would do the same in I always think of a chip pan fire in that scenario. One of the biggest things is just to take care though, when you're cooking meals, when you're generally at the clients, take care, don't get distracted. Don't let them distract you. If you're microwaving a meal or cooking a meal from scratch, don't leave something on the hob or in the oven, and then for them to shout you across and say, can you just help me with this and that and the other. Do just be mindful, even if you have to turn off what you're doing and then go and help them and go back to cooking their meals. Other than that, it's don't overload the sockets. Always have fire alarms installed and smoke alarms installed. Don't use faulty appliances and faulty wiring. If there's anything which you find which is faulty, please report it to the office. We cannot remove items from people's homes. That'd be classed as theft, but we can report it, speak to families, speak to social workers. It may be that the registered manager or your general line manager says just to put that to one side so the person can't use it for their own safety. So we're not removing it, but we're making that situation safe. So in the event of a fire, the first thing we must do is sound the alarm and shout fire. Whether it's letting neighbours know, whether it's letting the people in the building know, or your fellow carer if you're on a double up. So loud as you can, shout fire. After that, if it's safe to do so, close all the doors, close all the windows. It's either in the house or in that particular area, because that will shut down or limit the supply of oxygen that the fire has available and will slow its spread down. From there, it's initiate the evacuation as calmly and as safely as possible. So it's yourself, fellow carers, or the residents, or just you and your client through the nearest and safest exit. Just get out there as quick as possible. Don't let them stop to pick up personal items. Just get out and try to make the situation safe. If there is a fire extinguisher available and you are confident to do so, and that's really important that you're confident tackling the fire with the fire extinguisher, you can always do it. If the fire is too big, it's going to be too late. Just get yourself out. Then ring 999. Again, you can use your company mobile or your own mobile, but make sure everyone's safe. Call 999 and they'll want certain information from you. They'll want a telephone number so that they can call you back should you get disconnected, your address and your location. They'll want to know if all people are accounted for, have hazardous materials been removed, I always think, have hazardous people been removed? So is somebody still in there who may pose a threat? Somebody with dementia who doesn't know what's going on? Somebody, I suppose if this was a fire training for other situations like in a prison, or if there was a violent patient, if it was a hospital, they would want to know that as well. So any other key information. Is there anything in the house which will accelerate the fire? So do you know if it's you're at a client who's an old farmer, does he have an old petrol can in the corner in the cupboard of the kitchen which may accelerate it or explode, such as that oxygen bottle? Moving on now to fire extinguishers. Now you by no means have to memorize each of these fire extinguishers, but do just make yourself aware of what each of them do, because the last thing you want to do is spray a water fire extinguisher on an oil fire. You'll see the symbols on each of the images, so A, B, C, D and E, and each of those corresponds to what that fire extinguisher can be used for, and those symbols are on the fire extinguishers themselves. Also, you'll notice the different colours, so while all the bottles themselves are red, they each have a different coloured label. So water is red, dry powder is blue, foam is cream, and CO2 is black, with wet chemical yellow. And again, you'll see that while you're out and about, but the main thing with fire extinguishers is only tackle it if you're confident and trained to do so. They're fairly simple things though. Pull the pin, squeeze the trigger, point at the base of the fire, but these are the golden rules of using fire extinguishers. Always point the fire extinguisher at the base of the fire. And in the case of a carbon dioxide fire extinguisher, do not hold the plastic cone, because while in use, that cone will become very, very cold. Make sure that the fire extinguisher's service record is up to date. Make sure that the pressure gauge is green and not too low pressure or too high. In case of an electrical fire, if you can and it's safe to do so, isolate the power supply. Always keep yourself between the fire and the exit. And do not fight fires in confined spaces. You'll find the fire will spread too quickly, the oxygen will be taken up by the fire, and you'll find yourself in big trouble very quickly. And those are the golden rules of using a fire extinguisher, or tackling a fire with a fire extinguisher. In any situation, any building, any public space, or certainly in the case of going to a client, a risk assessment will have taken place, and that will have been taken place by your line manager or by the register manager or someone at the office. And risk assessments have 5 steps, and that is to identify the risk, identify who is at risk, can we mitigate that risk, we record those risks, and then we review those risks in 6 months, 12 months, or whenever something new or changes in the environment. So if we go on in March and everything seems safe, but a broken appliance, a faulty appliance wasn't there, and a month down the line you go make a visit and there's a faulty kettle, you then report that, and we would have to make a risk assessment on that kettle, a piece of equipment, or maybe on that environment. So identify the risk, any faulty wiring, pets, open fires, who's at risk. Well, in our case, it will always be the client or yourselves. Can we mitigate that risk? So again, if we know that somebody dries their washing in front of the fire, we need to either inform or educate that client not to do that, and the reasons why. Are they doing that because they haven't got a dryer and they just feel it's okay not to replace it? Record it, so we take that risk and the actions we've taken, and we record it down, and again then we review it in 6, 12 months or when something changes. That is the end of this fire training video. Please feel free to watch it again. There will be a short assessment, probably 5 to 10 questions, just to kind of process that everything has gone in. So like I say, please feel free to watch this again. We always recommend feedback and welcome feedback. So if there's anything you feel should be in there, could have been better, could have been explained differently, and we can make some changes for next time, again, please feel free to email us at care@ or speak to somebody directly at the office. But other than that, I hope you enjoyed it, and to see you soon.